Hi, my name is Dr. Erica Steele, and I'm a naturopathic doctor and founder of Holistic Family Practice. Oftentimes, when people come into my practice, they've been to a lot of other doctors. I'm never really the first doctor most people see. I'm typically either the fifth, the sixth, the seventh, or sometimes even the last. And the experience that I have with a lot of people is that they've been to many other doctors. Before they even go to the doctor, they feel like something's off. They feel like their body's not in balance. They can't put their finger on it. They don't know why. They're tired. Their hormones don't feel good. They've got brain fog. They're bloated. They've got varying digestive symptoms, and they just don't feel well. They don't feel like themselves. And so they go to the doctor, usually like their primary care or something like that, looking for answers. That doctor will usually, run some general labs, or they'll listen to their symptoms and go, well, maybe it's this and maybe it's that. But then a lot of times the labs will come back where there's nothing, or at least nothing that they can see. Or the doctor will kind of have their own view and go, well, and I'm paraphrasing, but something like, well, this doesn't fit in a textbook, so there's nothing wrong with you. And the lab work comes back, there's nothing that they can see, and there's nothing wrong, right? Like maybe you're stressed, maybe you need to, take some time off, or, maybe you just need to lose some weight, or, some of these little kitschy kind of things that are spoken rather than real fruitful answers. And so where that leaves a patient when they're not feeling well, they know they don't feel well, they go to a doctor, trusting them to be able to guide them through, and the doctor pretty much dismisses them and says, it invalidates their feelings and says, nothing's wrong, it's kind of pretty much all in your head. Or they go, oh, well, I don't know, but go to this specialist or that specialist or this specialist. And now the patient is going to all these different specialists and still getting kind of the same answers, or like, oh, well, maybe this is a little off, we'll retest it. Lots of diagnostics, lots of tests, and not a lot of answers, let alone practical application about what to do about these specific challenges with the health. And so it continually invalidates a patient, and they feel disheartened, they feel frustrated, they feel let down. And of course, they're not feeling well to begin with. So this additional burden of like, I can't get any help, creates this feeling of powerlessness, helplessness, hopelessness, fear, and then eventually you feel, well, this is the way it's going to be. It's always going to be like this. My body's turning on itself. It's betraying itself, et cetera, et cetera, et cetera, which, those thoughts create more victimization and more helplessness and more powerlessness, which then keeps a person more and more stuck in the feeling and as well as the physical state. And so by the time a patient comes to me, they're extremely skeptical. They're very resistant, fearful. They don't trust doctors. I hear that a lot. I don't trust doctors, right? And it's because they've been let down, and they've been let down by the traditional allopathic community, who hasn't listened to them, at very least, hasn't validated them, validated how they felt, or even said, I'm not sure. But let me look into this, let me check this out, let me, dig deeper, sort of thing. And a lot of times it's because they're in the insurance model. So in the insurance healthcare model, the provider only has about 15 minutes with the patient max. Some of that is also spent on vital signs. And so they really don't, it's a volume game. So you have to see a certain number of patients in order to really, law of averages in terms of the insurance billing. And so you're able to make enough money to sustain a medical practice, because medical practices do have a high overhead cost with staffing, et cetera. And so, the patient's not privy to that. The patient doesn't understand the dollars and cents and the finances behind healthcare. And why should they, right? They're going in, they're using their insurance to pay for it. And, they expect care. However, the insurance-based model really is not designed for there to be a whole lot of care. One of the reasons why we went concierge years ago at the beginning of healthcare reform was really to put care back into healthcare. That's one of our mottos, because I could see that it was just not sustainable to deliver the level of care, the quality of care that was required for the patients, especially because the cases that were coming in were far more complex than a 15-minute appointment. They needed some time to just decompress. They needed some time to be educated. They needed some time for me to go over the lab work and go over, their comprehensive health history to really understand and pinpoint the causes of why they're feeling the way that they're feeling. And I'm not in symptom management. Allopathic doctors, which is an insurance model, typically are in symptom management. So it's like, oh, I've got a headache, I go to the doctor, here's a Botox shot, and you call me in 3 weeks and we'll see how it goes, kind of thing. It doesn't look at, okay, this migraine could be coming from heavy metal toxicity or mold exposure or food dye or coloring or any number of things. I'm just throwing things out there because there's thousands of causes, and it's never one thing. It's always a combination of things that build a symptom. And so patients are really very frustrated and they're not getting the help that they need. Allopathic doctors are not trained in nutrition, and they're not adequately trained in biochemistry and reading the labs. I want to also say too that I love allopathic doctors. I love medical doctors. I love osteopathic doctors. I love nurse practitioners. I love healthcare professionals in general. I'm in healthcare. I'm a part of healthcare, and I love all the facets and all the ways we look at things differently, right? So, I look at the body from a causative perspective, from a nutrition perspective, from a detox perspective, from a biochemical perspective, right? And that's my jam, and that's what I'm into, and I'm super excited about it. However, if a patient needs a cardiac workup, I'm not your gal. I'm going to send you to a cardiologist and have them do that full battery of diagnostics and evaluate the structure and function of the heart, because that's their job and that's their role. So I think it's also understanding that we all have a different role in healthcare. Unfortunately, there's not enough doctors like me. And this is not a history lesson, but that's kind of intentional, to discourage more healing practices and move into more of a diagnose and manage model. But really, it's failing our people. It's failing, the people that need it the most. And it's sad, when you have people coming in and they're on 10, 12, 13 different medications and they're still in pain, they're still suffering, you can see it's not working, or you can see where let's say they're going to a nutritionist, but the nutritionist is giving them wrong information because they're not adequately trained or they're not actually doing the practice. They're not actually doing what they're telling people to do. And so they're giving wrong information that you can only learn if you actually do it. A lot of times the things that I do with people, it's because I've learned it because I've done it myself, or I've learned it practically by working with people. About 4 years after I became a naturopath, I really had to throw my books out because the patients weren't fitting into the textbooks. The patients had a whole myriad of things going on that just were not clean, cut, and dry. And so I had to really think outside the box. I had to really push past what I thought I knew in order to really help the patient. So it required me to throw my textbooks out and really be with people and listen to people. And then through my knowledge and expertise and understanding, then leverage that and create more of a partnership and a relationship. And so I love that old school family doctor. And that was the vision behind bringing holistic family practice to life, was that old school family doctor and bringing that, connection back in. And I've built some incredible relationships with people and helped so many different families over the years. And I'm truly blessed and grateful for that experience. And it's so disheartening to me when patients come in and, I review their labs to them and they get so emotional and they go, oh my gosh, I knew something was wrong. I knew it's not all in my head. I'm not crazy, right? And what saddens me is that they actually thought that they were crazy, and they'd been to several healthcare providers who only just continue to reinforce that. Instead of them saying, you know what, I don't know, or I'm not sure, or your symptoms are valid, or your feelings are valid. It's just not my area of expertise. Maybe, go to a different provider, right? Instead of that, they're kind of holding on to this ego and pride and going, no, we know all the answers. You're the patient. You don't know anything. they dismiss the patients, and that's very heartbreaking. And so it creates this distrust in healthcare that doesn't really need to be there. The distrust doesn't need to be in the healthcare relationship. Honesty and integrity is really important, and really important to me in my practice, which is why, if I don't know something, or if I don't understand something, I'm going to be honest about it. Or if that provider is not me, if I look at a case and go, you know what, you need to go to oncology first and slow this tumor down, because guess what? This is fast growing, and, there's nothing natural that's going to stop it, so I have to be honest. I have to be in integrity. I have a high level of responsibility, and I take, caring for people very seriously. I feel like God entrusted me with this gift and this ability to help and discern through these very complex biochemical structures. And so I want to make sure that I serve him and serve the people, in the best way possible, the most integrous way possible. And so I choose to be honest when I'm looking at a case from my opinion and based off of, hypothesis, right? So science is what the patient tells us. We have a hypothesis, we prove or disprove it with a lab, we assess it, we create a plan, and we keep modulating the plan. That's the deal, right? And unfortunately, in our current healthcare model, that's not the plan. It's listen to symptoms. Okay, all right, cool. This is the medication. Here you go. This is the procedure. This is this. Da da da. Oh my gosh. Hurry. Fear. You got to do this, or else. Da da da. Or we don't know. I don't know. You're crazy. Goodbye. And it really is not serving us, and it's not serving, the people. So hopefully, this helps validate some of you, and you're not crazy. Something is wrong. Something's going on, and really seeking out second, third, fourth different opinions, and looking outside of the box is key, because very rarely does anybody fit inside the box. Maybe less than a handful of people over the 30,000 patients I've treated or worked with have actually fit in, the box. And those are pretty bad odds if I was betting on anything. So if you know your body better than anyone, so if you don't feel like it's working, or it feels good, or whatnot, right? And there's some other, it doesn't always have to feel good, right, for it to be working, but there has to be some validity to it. And on some level, there has to be resonance. It has to make sense. And if it doesn't make sense, don't try to make it make sense. It's about trusting yourself, trusting your intuition, and allowing it to guide you through this process of healing, because that's really what it is. It's a process of healing and self-discovery. It's not a quick fix or a fast solution, especially for chronic conditions. There are only fast solutions. It's consistency, it's stability over an extended period of time. So hopefully that was helpful. My name is Dr. Erica Steele, and we help families and people, humans, live naturally.